Are your food choices making your joint pain worse? If you have osteoarthritis, some foods might actually be fueling your inflammation. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge, personalized care. Today, we're diving into a question I hear all the time. What foods are bad for osteoarthritis? Osteoarthritis is a wear and tear condition that affects the joints, but did you know your diet can either help or hurt your joints as well? Some foods increase inflammation in the body, which can make your arthritis symptoms worse. Let's break this down so you know exactly what to avoid and why. Osteoarthritis is the most common type of arthritis. It's not caused by your immune system like rheumatoid arthritis. It's more about wear and tear in the joint. But here's what really causes the pain. Chronic inflammation in the joint instability, and eventually cartilage breakdown. Think of your joints like a cushion. Over time, that cushion wears out. If your body is inflamed, that wear and tear gets worse faster. So even though osteoarthritis is not an autoimmune disease, inflammation still matters. What we eat affects our body on a cellular level. Some foods trigger our immune system to produce chemicals that increase chronic inflammation. This low-level inflammation can make your osteoarthritis feel more painful, become more swollen, and cause the joint to break down faster. If your goal is to slow down progression and reduce pain, then cutting out inflammatory foods is key. Let's discuss the top foods that are bad for osteoarthritis. We'll go through the biggest offenders. Number one are refined sugars. These are found in soda, candy, baked goods, and most packaged snacks. Why it's bad? Sugar increases levels of inflammatory messengers called cytokines. It also spikes your insulin, which promotes weight gain, a big problem for joint pain. Here's a pro tip. Swap out soda for flavored sparkling water. Choose fruit for dessert instead of cookies. Number two are processed carbohydrates and white flour. This can be found in white bread, pasta, crackers, and breakfast cereals. These are high glycemic foods. They can spike your blood sugar, which increases inflammation. Some better choices would include whole grains like quinoa, oats, or wild rice. Number three are fried and fast foods. Foods like French fries, fried chicken, fast food burgers. These are high in trans fats and omega-6 oils, which increase inflammation and oxidative stress. They also cause weight gain, which adds pressure to the joints. Better option would be grilled or baked foods using olive oil instead of vegetable oil. Number four are red meat and processed meats. This includes beef, bacon, sausages, and hot dogs. Why it's bad? They contain compounds called advanced glycation end products, or AGEs. These promote inflammation and joint damage. An alternative would be to try fish like salmon or plant-based proteins like lentils or beans. Number five is, for some people, dairy. Not everyone with osteoarthritis has an issue with dairy, but in some cases, dairy proteins can irritate the joint lining and trigger pain. If you feel worse after eating cheese or drinking milk, try a 2-week dairy elimination holiday. A better choice would be to try almond or oat milk or choose dairy-free yogurts. Number six can be alcohol. Alcohol, especially in excess, increases inflammation. It also messes with your gut health and sleep, both of which can affect pain levels. A better approach will be to limit alcohol to 1 to 2 drinks per week or cut it out entirely. Number seven is excess omega-6 fats, which can be found in corn oil, soybean oil, processed salad dressings. These fats, omega-6 fats, can compete with omega-3s, which are the good anti-inflammatory fats. When omega-6s dominate, inflammation increases. Solution is to cook with olive oil, eat more omega-3s like walnuts, chia seeds, and fatty fish. What about trigger foods? Some people notice that their arthritis flares after specific meals. If you think that might be you, try keeping a food and symptom journal. Sometimes foods like tomatoes or eggplant, called nightshades, can cause issues for some individuals, even though there's limited evidence overall. The key is personalized care, what bothers one person may not bother another. Here's what happens when you eat better. You'll have less inflammation, less pain, require fewer medications, and often less need for invasive procedures. That fits into the core principle we follow here at Chicago Arthritis, where we try to start with low-risk lifestyle changes first and only escalate to injections or procedures if necessary. And of course, surgery should be your last option, never your first one. Let's recap with some easy swaps that you can make in your diet. Try this instead of that. Instead of soda, try sparkling water with lemon. Instead of white bread, try sprouted whole grain bread. Instead of fried chicken, try grilled chicken. Instead of bacon and sausage, go with wild-caught salmon. Instead of cheese sticks, go with hummus and veggies. Instead of candy, go with fruit and dark chocolate. Even small changes, if done consistently, can reduce pain and help you feel better. So if you have osteoarthritis, I recommend a diet rich in colorful vegetables and lean protein. Minimizing processed and sugary foods, focusing on weight management to offload the joints, and staying active daily to help joints and muscles stay healthy. Sometimes we combine this with supplements, exercise, or regenerative medicine procedures like prolotherapy, PRP, or bone marrow concentrate stem cell treatments, depending on what's needed. And it all starts with food. To sum it up, osteoarthritis is a mechanical issue, but inflammation does play a role. Certain foods increase that inflammation. By avoiding those foods, you can feel better and function better. Diet is one of the easiest, safest, and most effective places to start. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. And if you're looking for a personalized approach to your joint pain, reach out to us. Thank you for watching, live well, and see you next time.